Hello, good afternoon. Today I'll be providing an update on the current metrics and reviewing our progress in our vaccine efforts. As of yesterday, we have confirmed 27,658 total cases of COVID-19 in our community. This is an increase of over 9,500 since July 1. When we were seeing some of our very lowest levels, if you might remember, our very lowest levels of cases and transmission just before this most recent surge. And that just is to underscore the very significant impact that the Delta variant has had on our community, particularly our unvaccinated neighbors. In that same time, since July 1, we've recorded over 80 new COVID-19 related deaths in our families, our neighbors, and our friends, now bringing our total to 412 COVID-19 related deaths since the pandemic started. In terms of our local metrics, which are on the screens now, we are continuing to see a decline in our cases, seeing a drop in the case rate from 198 to 162 this week. Again, this is a very hopeful sign, but we continue to say that these levels are not yet at a very desirable or low level. You can see they are still blazing red for cases. Our percent positivity as of yesterday was 6.1. This indicator has been in the 6% range for over 2 weeks now, indicating some stabilization with a very slow decline. Our deaths have remained high. We had about 11 deaths reported to the dashboard in the last week. Our hospitalization rates remain encouraging, seeing a steady decline in hospitalizations and ICU utilizations. This is very hopeful that we will soon see the same encouraging trend in our death rate as well. So the bottom line here with our metrics that Buncombe County is still an area with high transmission despite the decrease in case rates that we're seeing. We're just not seeing them at levels low enough yet at this time. So with that being said, at this time, I continue to monitor the metrics throughout this week prior to making any recommendation regarding the local face covering requirement. But just as we have for months now, the data will be driving our recommendations. I did want to take a deeper dive, as we do in some of the actual new cases. The total number of cases has been decreasing, as I stated just before. This is true in almost all age groups. Ages 10 through 14 and ages 15 through 17 saw no significant change in the last week or so, whereas all other groups did see a decline in the absolute or the total number of cases. And while the actual number of cases is declining, the proportion or the spread across those age groups has not changed much in the last several weeks. So what has consistently been true is that our ages 25 to 49-year-old continue to make up the majority of our new cases. And individuals less than 18 years old, so our 10 to 17-year-olds, are making up right now about 24% of all new cases. This has been also rather stable for the last several weeks. And as mentioned before in previous briefings, the lowest burden of cases is actually in our oldest population, which also happens to be our most vaccinated population. I wanted to take a moment to highlight vaccination status on COVID-19 outcomes. As we are continuing to move through this Delta surge, vaccination status did matter and still does matter. In particular, those who were unvaccinated had a risk over 4 times that of a vaccinated person to become ill. Additionally, and what you see on your screens right now, the overwhelming majority of hospitalizations, that is over 85% and almost 86%, and ICU utilization, that is almost 90%, were in the unvaccinated population. This, I believe, is showing us that COVID-19 vaccine that is available to us right now is reducing our risk of becoming ill. It's reducing our risk of serious illness should somebody contract the virus, meaning it keeps us out of the hospital and significantly reduces the risk of the need for ICU intervention. Lastly, most recent data from North Carolina Department of Health and Human Services indicates that the risk of dying for an unvaccinated individual is almost 20 times that of an vaccinated individual. We saw the biggest increase in our vaccination uptake by age in our 18 to 24-year-olds in the last weeks. That is to be celebrated for sure. Increasing about 2 percentage points is the last update, from 56 to 58%. And then we, as Buncombe County HHS, saw our greatest increase of vaccination uptake around the same time that we were seeing the highest rates of new cases. So that hearing that those new cases were coming in, seeing those hospitalizations, definitely hearing about increased deaths, we believe definitely was a motivator for folks to come and get their first dose. Since that time, it's actually been relatively stable, with us reaching anywhere between 400 and 600 doses, total doses each week, with the exception being that first week that we had the Pfizer boosters available, which was September 27th, when we saw the highest demand for those boosters and had over 1,000 doses given, total doses given that week. As a community amongst all vaccine providers and all vaccine efforts, we have reached 73% of adults having received at least one dose of vaccine. And when we look at the eligible population, that is those who are 12 years and older, we have reached 71% of those eligible having received at least one dose. And we anticipate 5 to 11-year-olds to be discussed at an upcoming FDA meeting, which is scheduled for October 26th, and may see their eligibility as early as the first weeks of November. So before moving on and switching gears to our vaccine progress and our vaccine efforts, I wanted to review just how folks can find a vaccine provider if they have not already received their first dose. So please check out myspot.nc.gov. You can also visit us at our 40 Cox location, where we are giving out first, second, third, and booster doses, and there is a multitude of vaccine providers in our community now at your grocery stores and your corner pharmacies, and maybe even at your primary care doctors. And so just wanted to take a second to remind our community that there is a COVID-19 vaccine waiting for you at any one of those providers. Please don't risk getting the illness. Gambling with COVID-19 can be detrimental to you and devastating to your family. So just wanted to take a moment to remind everybody that additionally, as folks are thinking about their first dose, if they haven't already gotten one, to take a moment to let folks know that Delta variant is still widely circulating around us. And as that's occurring, we are also entering cold and flu season. And that this time we are seeing very little flu, but that means it's a really great time, if you haven't already gotten your flu vaccine, to go and get your flu vaccine. But we are seeing some cold virus circulating. However, overwhelmingly, what is circulating right now is Delta variant of the novel coronavirus. And so in terms of respiratory illnesses, please, if you start to have symptoms, please get tested. Don't make an assumption that you have a cold. Right now, the most overwhelming thing that is circulating is the Delta variant, so please get tested. And you can find a testing provider by searching Find My Testing Place website. You can visit Harrah's Event Center Monday through Friday. I believe it's from 10 to 2 to get tested. And we also still have a state-supported testing site on Sundays at AB Tech. All right, so we're going to switch gears and talk a little bit about additional updates that we've had and progress that we've had in our vaccine operations. So a couple weeks ago, we went over in detail all of the vaccine efforts that we have been undertaking for the last several months, with a focus on efforts this summer and into the fall, and just going to review and update those efforts today as we are nearing the end of our 30-day campaign and actively planning for our younger children to be eligible. So just to recap here, total doses administered by Buncombe County HHS and Emergency Management is at over 102,000 at this time. We still have our fixed site operations, which I just mentioned a few minutes ago. Our summer outreach, we did reach 62 outreach events through June to August. When Fletch presented those to you, you saw those sort of put out each month. Our homebound and at-home vaccination efforts, we've given out 231 doses since March. Boosters began the week of October 11th, and we're getting and partnering and have support through CareMedics for that. Our long-term care facilities, if you'll remember, there were quite a few long-term care facilities that the Buncombe County HHS did do mobilization of vaccine. Boosters are set to begin for those groups October 25th, and we'll be supporting about 2 facilities per week. Our booster site at Biltmore Church Arden campus, that began, as I mentioned earlier, September 27th. Over 1,550 doses were administered in the first 3 weeks. We did see demand wane after our first week, and it has continued to go incrementally down since then. That we've had also a successful partnership with the Mexican consulate the week of October 4th at the booster site, really for a focus of first doses, so folks who were visiting for support and resources that the Mexican consulate event was providing could come and get their first dose at our booster site. And if folks also needed to get their booster dose, they could get it there as well. We reached over 40 individuals for first doses during that week through that partnership. And I just want to have a special thanks to Zoe Mpofu from our Buncombe County HHS team, and also Carolina Salacio Perez from our Buncombe County team, and our partners at the YWMCA for helping us support that event. We did modify our hours at the booster site, now 10 to 2. That's reflective of the peak hours, Monday through Friday. And the site will be extended until October 22nd. And also in relation to boosters, we have the Haywood Street Congregation Booster Outreach set for October 27th. We embarked on a 30-day push for first doses with a very, I guess I would call it very granular and localized campaign to highlight local vaccine champions that shop at the grocery stores that we shop at, or attend or lead our churches in our neighborhoods. They coach sometimes our youth athletics and go to the same football games we're going to. So we really continued the vaccine outreach events here, building on the success that we had seen with partnering with our school systems, and schools being a very familiar and trusted place in our neighborhoods. They are often very central to our daily lives and, of course, our Friday nights. So we've had quite a bit of success there partnering with our schools, and continue to do that. Our last event is scheduled for Owen Middle on October 26th. That'll be our last event for the 30-day push before we transition and really put a lot of our efforts toward the 5 to 11-year-olds, which I'll be talking about shortly. And you can see we updated the slide here to show you how many folks were reached at each one of those events. And so the group that I think many of us have been anticipating for quite a while are going to be our younger children, 5 to 11. The FDA is scheduled to meet on October 26th and has the younger children, 5 to 11, as an agenda item for discussion. If the FDA does put forth a recommendation for authorization, we still have other steps to go. It still will require the ACIP and the CDC to put forth their recommendations as well after that FDA recommendation. And so, as I said earlier, we are anticipating that in the early days of November to have eligibility for that group. When that does occur, we've already started planning for modifying our operations at our 40 Cox location in the week prior so that our existing staff will be available for Saturday outreach. So we'll be running a Tuesday through Friday operation at 40 Cox, 9 to 4, which gives us Saturdays to be able to do outreach and allows us to have that Monday as a flex day and allow our staff still the same amount of downtime as we can. The Saturday school outreach tentatively will begin November 13th based on vaccine supply. We'll have one school event every Saturday from 9 to 4. There is a big focus on geographic distribution and access. So we'll have one week we'll have a central location, and then we'll be doing north, east, south, and west to make sure that we have access points for our entire community. We did have our third planning call with our school system partners who are hosting the sites, but it will be open to all children and families and communities, not just public school. Our public school partners have just been very generous to provide their campus as a central location for outreach events. I did want to say one thing that we've learned since the previous briefing is that North Carolina Department of Health and Human Services will be supporting what they're calling Pfizer family vaccination sites in about 10 to 12 areas within the state. Buncombe County will be one of those sites. This will be focused on about 6 weeks focus for 5 to 11-year-olds and their families, and lots more details to come, but we do know that we'll have a site here in the west in Buncombe. And as we approach that eligibility of 5 to 11-year-olds, we have 3 main focus areas for communication and messaging, and you'll see them here: pediatricians, family medicine doctors and providers, parents and caregivers, and then our schools. And so really here, looking to, when we talk about vaccine communication and getting information out to our providers and our provider community, taking our role as local public health to help demystify some of the perceptions of the COVID vaccine management system as being sort of arduous and hard, helping people understand how they can navigate it, get them looking into how to become a CVMS provider so that we have more local providers who are giving out vaccine in office, which we think may be desirable for some families, especially those who are at the younger end of that 5 to 11, where a doctor's office might be something much more comfortable. And then vaccine information to parents and caregivers. Just a tentative provider Q&A call is scheduled for the end of October to help inform our providers. And then focus on vaccine information to parents and caregivers. We have a tentative parent town hall being scheduled for early November when we have more of that information post the FDA and hopefully post some CDC and ACIP to be able to give them the most accurate and up-to-date information and help talk about the benefits of vaccine when it comes to quarantine and post-exposure. And then our third group, vaccine communications to schools. We have planning, we're doing our planning of the outreach events with geographical distribution, but also a tentative school town hall, also scheduled for early November. And then this is just a summary again of what we'll be doing until the end of the year and into the new year. And I just want to thank everybody on our Buncombe County team and our partners for the very long hours as we continue to do case investigation, contact tracing, vaccine administration, answering all those community calls, crafting really wonderful messaging and communications from our team, or even ordering supplies and putting together outreach sites, like literally putting them together and constructing them, and so much more over the last 18 months. Thank you for the long hours and the weekends, and thank you all for your time and attention today.
Thank you so much. Commissioners, any questions? All right, thank you very much, and appreciate everyone's great work in
Commissioner,
all these
I
efforts.
just wanted to lift up one thing Stacie said earlier is around the mask mandate, that it does expire at the end of the month, but we're not bringing forward a recommendation to do anything yet. We want to monitor for 2 more weeks before we would have a recommendation. So I just want to make sure that everybody hears that.
Thank you. All right.